Welcome to the Dunn Wisdom Show, where faith meets focus and wisdom meets real life. Each week on the Dunn Wisdom Show, I love sitting down with change makers, trailblazers, and leaders who embody courage, integrity, and wisdom in action. I am your host, Melissa P. Dunn, and today we're having an important conversation about leadership, purpose, and what it truly means to build healthy, thriving communities. My guest today is Loreen Chant. She is the president and CEO of Health Foundation of South Florida and the very first woman to lead the organization in its 30-year history. Now, under Loreen's leadership, the foundation has invested more than $150 million to advance health equity, supporting collaborations, policies, and systems that create real measurable change for Florida, for families across Miami-Dade, Broward, and Monroe counties. Loreen and I share a long history of collaboration. The Health Foundation was the very first investor in the Lauderhill Health and Prosperity Partnership, and together we continue to champion real health equity through initiatives like Take Your Loved One to the Doctor and the upcoming Black Health Summit. Today, we'll talk about how leadership rooted in compassion drives impact, what it takes to tackle food insecurity and healthcare that's a crisis right now brought on by federal cuts. We'll also talk about how self-care keeps leaders like Loreen grounded in their mission. Whether you're leading an organization, a household, or a dream, this conversation will remind you that heart of health begins with taking care of each other. This is the Heart of Health, Leadership, Equity, and Impact with Loreen Chant, right here on the Dunn Wisdom Show. Hi, Loreen. Welcome.
Thank you so much. Pleasure to be here.
Oh, I'm so grateful that you were able to take time out of your busy schedule. Loreen, I want to know, tell me a little bit about the Health Foundation and your journey to joining the organization.
Oh, thank you. Thank you for asking. So I actually joined the Health Foundation family when I was president at Johnson & Wales University. And I joined as a member of the board of directors. And at the time, I was looking for opportunities to give back to the community in my role as president at the university, and had the opportunity to meet the then CEO, Steve Marcus. And then really was a really proud, engaged member of the board of directors for 10 years.
Oh, wow.
Yeah.
I didn't know that.
Yeah, that's how I started. And then Dr. Marcus was retiring from his position, and the board was looking to bring in new leadership. And honestly, just had the opportunity. At that point, I was president and CEO of Easter Seal South Florida. So I'd left the university and then was leading a really fabulous nonprofit, Easter Seal South Florida, who was doing really important work in Miami-Dade and Broward County. And then and it wasn't a place I was looking to leave because, as you know, I always lead with heart.
Yes, you do.
Love every organization that I've been a part of, but the opportunity to come over and join the Health Foundation as a staff member was really intriguing and exciting, because at that point, the Health Foundation had really adopted a new strategy where we were looking to go beyond some of the work and the ways that we had been doing things, and really start to get into digging into the barriers, the root challenges, the social drivers of health, and looking at how we could use our resources and our voice to establish deeper partnerships with organizations doing work so that we could create more equity, advance health equity, reduce barriers. So it really was, and that was in 2021.
2021.
Yeah.
Wow.
It's gone really fast.
Yeah, well, I could tell you, I have always enjoyed our opportunities to talk and interact, and I found that the work that you're doing and the foundation together, it really is getting to the root of some of the most challenging issues that we're facing in community. What made you decide that that shift in strategy was important, and what was the reason why you guys decided to make that shift?
Yeah, I mean, it's a great question, and I can remember sitting in the room, and at the time, the foundation has always done great work. So there's absolutely, but we have become broader in the way that we think about it, and there was just a really conversation on, if you don't work upstream and start to get to some of the root issues affecting the health disparities and the outcomes, then we're just never going to be able to get to our goal, which our vision is that all individuals in South Florida will have the opportunity to live their optimal health, to achieve their optimal health. And if you're trying to do that through health care, you're just never going to get there. We can't ask the healthcare system to take on and move people from the their poorer health or lack of health care if the drivers of those are often food insecurity, housing, economic disparities. So the healthcare system can't address those. So the board, the staff at the time, were really looking at other communities, national models, to see how are other communities addressing these issues in a way that's more holistic, more inclusive, advancing equity. And so it was a multi-year journey on the part of the foundation to really think about how can we get to better health by thinking about it more broadly.
I mean, because we know with the social determinants of health, only 45% of the healthy community has anything to do with going to a doctor, right?
Right.
Yeah. So now you guys are taking a more holistic approach. And how does that inform where you fund and where you invest?
It's a great question. So we have identified 3 areas of, like, what we call them our strategic pillars. One of which is called access to health, right? So and that's critical. So, and the way that we think about that is, we say if we can increase the number of individuals who are covered by health insurance, that's a great opportunity and sort of lever for access to health. And the other is increasing access to primary care. Because if we can get individuals linked to a primary care physician, then those issues around chronic disease management or prevention screening, some of those other things can really be rooted in the relationship with primary care. So we're measuring our work and our impact in those spaces. We've been doing some really exciting things, I think.
You have. I've been following you, for sure.
You know me. I get excited about my work. So I'm going to tell you, we've been doing really exciting investments and partnerships, particularly in supporting our free clinic infrastructure in South Florida, Miami-Dade, Broward, and Monroe County, actually. And then the next area that we think about, so if we can do that with some of our resources and some of our relationships, what more? What's more? What's next? And so we have really, I think, established some very strong collaboratives, which is not easy. Collaboratives are hard. Organizations are strained, resource constrained, and all of those things. So collaboration actually sometimes creates more work, but you can get further, right?
Faster
that's
together.
Right. That's right. So we've established some funding and some support for some what we call health equity collaboratives. And that's where we're bringing together the healthcare providers with the community-based organizations to work side by side on those social drivers of health. So we have several maternal health collaboratives. We've got a collaborative addressing diabetes for vulnerable communities, and that's where we're bringing together, I don't know, probably 20 different community-based organizations together with health providers to solve for those challenges and to create opportunities in those communities that we're targeting.
That's how I became familiar with Health Foundation, because you funded the Live Healthy Miami Gardens project, and I was working with Miami Gardens at the time. So that's how I became familiar with the work, is through the collaborative piece. And then, of course, you were one of the early investors in the Lauderhill work that we were doing as well.
Yeah, and I'll tell you that work that we did, that Live Healthy work, we see it live on in what you've been leading in Lauderhill. And it's been a very powerful model of grassroots engagement, cross-sector collaboration, right? And so we're happy to see the work that you've been doing there.
Thank you. So what's the third pillar?
The third, absolutely. The third pillar is what we call thriving communities. And so in that space, we have our South Florida Anchor Alliance, and that's
which is so powerful.
We're so proud of that work, and
we
absolutely are. And so that's where some of our largest organizations in South Florida, working across county lines, which I know is pretty uncommon. Usually work that happens in Dade stays in Dade, work that happens in Broward stays in Broward. But that's an alliance of our health systems, universities, school districts, municipalities, Lauderhill is a member of that as well. And that's where the groups are coming together to think about and find solutions for increasing access for local small businesses to procure with those large systems. I know that Lauderhill is under you also kind of doing that with your boot camp and other opportunities, because if we can create more economic opportunities for our small businesses, then that brings more dollars into our communities.
Yes.
And again, that's a pathway to access to health.
It is.
So it's hard to be healthy when you're economically struggling, when you don't have good housing, transportation challenges. And so the other piece of that thriving communities is we have been really partnering on finding solutions for the affordable housing crisis, which is escalating.
A big issue across the U.S. and particularly in South Florida.
I want to say I feel like we, in many ways, are the epicenter of that challenge.
Yeah.
It's a challenge. It's a national challenge, but it is really an escalating challenge for our communities when we see how many families are spending more than 50% of their income just to keep a roof over their heads.
Yeah.
So that's work we've been advancing as well. So those are our three. Those are our three areas of work, and then we always try to be responsive to community needs too.
Yeah.
So.
Well, when we come back, I want to talk a little bit about what you're doing to respond to the crisis that's created now with the recent federal cuts. So stay tuned. We'll be right back. What a beautiful day of food, family, and gratitude. This Thanksgiving, I invite you to celebrate with purpose. Order your holiday dinner from Dukunu Jamaican Kitchen. You will enjoy island-inspired flavors and support Dukunu Cares Hurricane Relief Fund to help families in Jamaica rebuild and recover. Visit DukunuWinwood.com or scan the QR code on your screen to order today. You will enjoy it. The jerk turkey is amazing. I can tell you that for sure. So, from our families to yours, may your home be filled with gratitude, grace, and good food. Happy Thanksgiving.
Peace begins in the heart. And grows with understanding. Every shared story and every act of kindness builds a stronger community. In every handshake, smile, and kind word.
Join our movement, Lauderhill. Text Peace365 to 545454 and become a Lauderhill Peacemaker. Pledge your commitment to co-creating a kinder, more peaceful Lauderhill.
Welcome back. We're still here with the President and CEO of the Health Foundation of South Florida, Loreen Chant. So Loreen, I know that you are making, through the foundation, significant investments in helping communities to face the current, very real crisis around food insecurity and healthcare. Talk to me a little bit about what you're doing.
Great, thank you. Well, actually, as you know, food insecurity is an issue for our community all of the time.
In general,
as a general comment. But knowing now that SNAP benefits beginning in November have been cut off. We don't know for how long, as you know, you've been watching. But even before this, I think I want to be really clear. The Health Foundation, in partnership with the Better Together initiative, which is being led by Memorial Health System and Broward Health, established a task force that Better Together established a task force to really bring organizations together to identify opportunities for addressing food insecurity. So this is work we've been doing for about 8 months, which sets us up very well because we really wanted to understand where are the most food insecure blocks, communities, so that we can target our interventions and the resources to those most in need of support. So kind of put that aside for a second, but now here we are today. Senator Nan Rich, Broward, oh my gosh.
She's doing amazing
She's
work.
doing an amazing job.
Yeah.
And when she understood that this SNAP crisis, food insecurity, was going to require an incredible collaborative effort among funders, food pantries, food banks because we need to mobilize quickly.
Yes.
And so she brought us all together 1 week ago today. And in that very short period of time, here's what I would tell you has happened. And by the time this airs, perhaps this will be old news, but we have collectively raised about $1 million. Right?
Wow.
And let me tell you who has done that work. So United Way has been a leader in that space.
Love it.
Community Foundation of Broward, Health Foundation of South Florida, Broward County, the Jewish Federation of Broward, and Children's Services Council.
Fantastic.
And secured significant contributions, financial contributions from the health systems and others. And what we're going to do, what we are doing, not what we're going to do, is we're going to use those funds to buy food so that we can get more food into the pantries quickly,
Wow.
who are serving those individuals and families who are missing meals, frankly, missing meals before. So it's not uncommon. When we were looking at the data, we were seeing families missing 3, 4, 5, more than 6 meals a week, even after all supports were added.
Wow.
So then when we eliminate SNAP benefits, and so you know, in Broward County, about 214,000 households are covered with SNAP benefits. It's about 370,000 individuals who now don't have access to their SNAP benefits, so food insecurity getting worse.
Yeah, and this is a tremendous concern, not just for Broward, but for my city. A recent report that I saw showed that Lauderhill is 9th in the state of Florida for SNAP benefits.
The highest SNAP beneficiaries in 9th in the state?
In the state. 9th in the state from ranking cities, 9th in the state.
Wow.
Which is really concerning, right?
Okay, so your city is really hurting.
Yeah, my city is really hurting. And then when you think about that 33311 zip code with Lauderdale Lakes, Lauderhill, Oakland Park, city of Fort Lauderdale, traditionally in Broward County, that zip code has been really the highest hit when it comes down to any social determinants of health, from food to Medicaid to Medicare. And so I'm so grateful that that you guys are coming together to address this need in such a powerful way.
And I will tell you, Broward, we call ourselves the collaborators, the collaboration county. And I think that when we see the community struggling, and we're blessed, and I know we'll talk about this, to be in a position to help, then we have to.
We've got to.
We have to.
100%.
We have got to. Energy, resources, strategy, collaboration,
and vision. And that's so important.
And the relationships that exist, right?
Yes.
There's no one in that room who isn't working together already. So that makes a difference too, because an enormous amount of trust.
Yes.
And okay, you do that well, okay, you do that. I do this well, I'll take that. I can make that easier, okay, give me that. And so, I mean, that gives you a lot of energy. When times are hard, who you're surrounded with makes all the difference, and then the community benefits, right?
See, and that's so important. And I think that's the difference when you lead with heart. Right? That's the difference when you lead with heart. Talk to me about what your leadership mindset is. What's your leadership philosophy?
That's such a great question. And anyone who works for me would say, and I think we have a little similar style in this regard. First of all, I'm always mission focused.
Yes.
I have no ego. I'm the least interesting CEO, right? I just don't. It's really always been about the mission, whether it was the university or Easter Seals or here. I've never had a job which was measured by how much money or profit. There's just never been the work that I've done. My work has always been around creating opportunity, whether it was for students or families or now community. So that's my DNA. And so in that space, I think always staying focused on what we're trying to do.
Yes.
And then just my philosophy is, honestly, and I've never done it better than here, build a team of the best of the best. Who knows so much and never be the smartest person in the room.
Yes.
I'm a fast learner, and I love to listen, and I love to share the opportunities and sort of the solutions. So my leadership philosophy is like surround yourself with really smart people who think differently, because we really do need to challenge ourselves and then have courage and then share it. So people don't work for me, they work with me. That's my mindset, and it's been that way always. And so my philosophy is surround yourself with great people, stay focused on what's important. New, as I've gotten older, I'm not so good at this, and I don't think you are either. Say no when you need to.
That's
And,
harder.
It's really hard, especially when we're trying to tackle difficult things. But if you take on too much or get distracted by what other people think needs to be done, that, okay, she can do that, or you go do that, you wind up diffusing your impact and exhausting your team. I can sometimes be a little much from an energy perspective. From an energy perspective. So,
are you like me sometimes at 1 o'clock in the morning when I'm awake? I'm like, listen, just because I'm sending the email now doesn't mean that I'm expecting you to respond.
Okay, I've learned. I send the email to myself. And then I try to send it out later because I have really tried to be a little bit less intense in that space. But yeah, so that's my new trick. It's relatively new.
Okay,
Send it to myself. So if my team
first
is on vacation, I try. They're always engaged, though. I have to tell you, I have the best team, and I know you know Janice, Alicia.
You do have an amazing team.
I have a great team.
Very
smart,
smart team, and a team of women too. You have a lot of women working on your
right
your leadership
now. It's all
team.
women. That's not by design. It's by default. But we definitely have a lot of fun. And that's the other piece. My leadership style. We have to have fun. We have to laugh. We have to work really hard. Support each other. Right. So right now it is a team of all women.
So collaboration over competition.
Oh my gosh.
Focus and really commitment. It sounds like I'm hearing you say, because knowing the women on your team, they all seem to have the same drive and passion that you have for the mission.
Yeah, we absolutely do. We don't always think the same, and sometimes we can get into a little bit, but I think that's good.
Like
in a
healthy.
Good way. Challenge.
Absolutely.
When I say get into it, I mean challenge
in a professional way.
Challenge
Absolutely.
each other.
Iron sharpen iron. Right?
That's right.
Iron sharpen iron.
That's right.
So I'm curious. These times are really challenging. Right? We are facing, I think, the most confusing, combative time in recent history in terms of the public discourse. What do you do to keep yourself centered, to keep yourself encouraged?
It's a great question. I have to tell you, I don't watch the news anymore. I track what I need to track, but I'm not an over-consumer anymore by any stretch.
Yeah.
Not too long ago, I was a little bit of a news junkie. I love to learn and know what's happening. So I will say I have shut down the noise significantly because I need to protect my peace and stay hopeful.
Ooh.
I don't want to be hopeless.
Say that again. Protect your peace and stay hopeful.
I have to stay hopeful.
Yeah.
I cannot get drowned in the hopelessness. And if I spend too much time, then I could feel hopeless, and I don't want to feel hopeless. I am hopeful. I try to be hopeful. So that's number one. And then I have a great family.
Oh, I love that.
And I tell myself this all the time: I have everything I need. Right? Maybe not everything you want, but we have everything we need. We're very blessed right now in that regard. So I take a lot of time to spend with my family, and when I'm with them, I try very hard to be with them.
To be present.
Try very hard. And then the other thing is I really do try to take care of myself more than I used to. I'm getting older. And so now I try to take better care of myself, be mindful, because if, you have to take, it's ironic, right? The Health Foundation, I have to take care of my health.
Yeah.
I'm really trying to keep up with my screenings, be a little bit active, eat right, those kinds of things. So I'm trying to take care of myself better.
I love that. I love that. Stay focused, take really good care of yourself. So what's the one thing that's challenging you right now that you're working through?
Well, that's a great question. I do think the escalating challenges in the community and figuring out the right, to my point earlier, what is the role we can play in being additive and not distractive. And so the challenge right now really is very active on trying to bring resources to the right communities in response to the SNAP crisis. And then the other area that's kind of concerning, significantly concerning for us right now, is the elimination of the subsidies for insurance, those that are insured on the exchange.
That is
so what I would
crazy.
say is South Florida has more individuals covered on the exchange than any other community in the country. So we stand to lose the most when those subsidies are expiring. And we've heard, it's hard to know whether it will really happen or not. It seems that it will. Insurance premiums will go up, I'm hearing, in the hundred, doubling.
Wow.
So we know that means that those individuals are going to come off insurance. We've seen some estimates that say 300,000 individuals in Broward who are currently covered on the exchange are going to move into the uninsured community on January 1st. Hard to know if that's true, but that's a really big number.
That's a big number.
So for an organization
yeah.
who, I told you when we started, access to care and increasing insurance enrollments are two of our strategies for advancing health equities, that's a big threat to our community and to our mission. And so we recently made over a $1 million investment in the free clinics in Miami-Dade and Broward County, because we know if those individuals don't have insurance,
they're going to need to
be seen somewhere.
Yeah,
we don't want them to go to the emergency room, because that's not the best place for care. That's not the best place for non-emergency care.
Yeah.
And so we want to make sure our free clinics are in a better position, and they're amazing. They always do amazing work, but they need more resources in order to step up and serve more individuals. So that's emerging work right now, very, very timely, and we're very concerned about what's happening there.
Well, I tell you, the issues were there before, but now with the cuts, it's going to be exacerbated. I'm really grateful that you and your team are really leading that space, making sure that our community is healthy and prosperous.
Well, I want to thank you. And you know that we've worked closely together on many things. Black Health Summit, which is near and dear to both of our hearts.
Yes.
Take Your Loved One to the Doctor campaign, which emerged out of our Black Health Summit in 2024. And so I can say, I want to thank you. And I know I tell you this all the time, but thank you. You're an amazing community leader.
Thank you.
You're focused on the right things, and we're proud to be a partner with you. We really are.
Thank you, Loreen.
Absolutely.
We'll be right back.
Peace begins in the heart. And grows with understanding. Every shared story, and every act of kindness builds a stronger community. In every handshake, smile, and kind word.
Join our movement, Lauderhill. Text Peace 365 to 545454 and become a Lauderhill Peacemaker. Pledge your commitment to co-creating a kinder, more peaceful Lauderhill.
So we're back with Loreen. We were just talking about all of the things that the foundation is doing to be responsive. And I'm curious, as you sit in the seat of leadership now, there are a lot of young people, I think, that's looking to get to where you are. And perhaps even a lot of women that's dreaming about what's possible for them. Do you have any words of wisdom to share?
Thank you. I would say what's always been helpful for me is I call it a personal board of directors. I've curated and cultivated people that I really trust so that I can check myself, go out and get guidance. So I would say my advice would be find your mentors, find the people outside of your necessarily of your day-to-day work. Make sure that you've got other voices, that you have the opportunity to be coached, to be mentored. So for me, that's been very helpful. I've been the beneficiary of mentoring since my time at the university. Great coaching along the way. So I think I have a personal board of directors.
I love that. A personal board of directors.
I do. And I'm sure you do as well, right?
I do, but I haven't formalized it like that. I haven't really thought about it in such a structured way. That's powerful advice. I'm going to take that.
I try. I think it's very important because we're working on really hard issues. I say these are not math problems. These there are multiple paths. Lots of perspectives that need to be considered. And then the other thing, so I really do, all of their faces are popping up, and they're from my time at the university. They're from my time on my community boards. Was on the United Way board, Health Foundation board, which I'm an Early Learning Coalition board. So that's the other piece. I would say this, and I can tell you that for my children, I say this, and I'm the beneficiary of this. Givers always get more than takers.
Yes.
And so give. That's my other. So when I was at the university, the way that I got my opportunity to go to Easter Seals was through my volunteer work on the United Way board. And then I told you that when this amazing opportunity came up to join the Health Foundation as CEO,
you were already on the board.
I was on the board. I was giving. right?
Wow.
So my husband would say, well, you're so busy running the university. Why are you on all these boards? You don't have time. You know, you're working nights, weekends, traveling. And I said, John, givers always get more than takers. I meet the best people. So I would say, be selfless. Get
I
involved
love
in your
that.
community, because you're going to meet the best people, and it makes you more well-rounded, and then it creates opportunities. So I would say that to young people, those two things.
I love that. And I would really, I'm a testament of that last piece too, because when I was working at Florida Medical Center, I was on the board of the Lauderhill Chamber.
See?
And when I started my business, my first client was a multinational that was a trustee of the Lauderhill Chamber.
See?
Yeah.
And when I was raising my kids, they're older now. Well, my youngest is turning 16. I would tell them all the time, because, you know, they see people that are seemingly getting ahead. But you have to play the long game, right? So
Play the long game. I love that.
Yeah.
Play the long game.
Yeah.
And givers get more than takers.
Right. So get involved.
Get involved. What powerful advice. Thank you so much, Loreen. I really enjoyed our conversation.
I always do. Thank you so much.
Thank you. So we had the opportunity to talk to Loreen about the wonderful work that they're doing at the Health Foundation of South Florida. And she really reminded us that leadership with heart can truly transform communities. Thank you so much for joining us for this episode of the Dunn Wisdom Morning Show. We know that Loreen's vision for advancing health equity and addressing food insecurity and strengthening families through collaboration give all of us hope, and it also gives us a blueprint for action. And if you are watching, I want to leave you with this thought. Real health begins with awareness of our purpose, our priorities, and our alignment. You are the one that can really make a difference in your own life. And that's why I'm giving you a free resource, the Freedom 90 Scorecard, designed to help you reflect on where you thrive and where you may need to realign and walk fully in your purpose. I want you to scan the QR code that's on the screen right now, or text Freedom 90 to 545454, and I will give you a free copy, because when you live in alignment, your mind, body, and spirit, we can create the kind of freedom that fuels impact. I'm your host, Melissa P. Dunn, and this has been the Dunn Wisdom Show, where faith meets focus and wisdom meets real life. If you enjoyed this conversation, be sure to like, comment, and subscribe so that you never miss an episode. Until next time, stay healthy, stay grounded, and keep walking boldly in your purpose. As we say in Jamaica, walk good. Be well, everyone.